Hello and welcome to today's Stepping Out Strong presentation. We're happy to have you here today. We're just gonna wait a minute or two to let everyone join the room, and we'll get started here in just a minute. Hello, if you're just joining us, we're waiting for everyone to join the room. We have a large audience today, so it takes a minute for everyone to join. Okay, we'll go ahead and get started. Thank you again to today's presentation of Stepping Out Strong. We have a trained peer educator, Jamie Colonna, and I'm happy to introduce her, and we'll turn it over to Jamie. Thank you.
Hello, everyone. Hope everyone's doing well. So today we're here to talk about your strength and stepping out strong. Do you know how to access your static balance? Would you like to have simple exercises to build into your daily routine to improve your strength and balance? Want to know how to prevent falls? Well, today we're going to talk about all those things. Welcome to the webinar, Stepping Out Strong. My name is Jamie Colonna. I am a trained bone health peer educator. I'm a physical therapist. I work in an outpatient clinic right outside of Philadelphia, and I'm a certified Pilates instructor. What got me really interested in osteoporosis and becoming a peer educator were the amount of patients that I had that came into the clinic who would mention to me that they had osteoporosis, but then they would never really say anything beyond that and didn't know anything how to follow up with it. So it piqued my interest and it got me involved with Bone Health and Osteoporosis Foundation. And here I am today to help all of you, hopefully. So thank you for joining us. And I'm pleased to present the program to you today. But before we start, I'm going to just cover a few housekeeping notes. If you have questions as we go along, please type them in the Q&A. To help facilitate the virtual webinar, we have moderators behind the scenes. If you don't receive an immediate response, I will likely address your question at some point during the presentation or the Q&A. If your question is not answered, please contact info@bonehealthandosteoporosis.org. This webinar is being recorded and a replay link will be sent in about 24 hours after the event's conclusion. We hope you took the pre-event knowledge survey before today's event, and we appreciate your time to complete the short 5-question survey. The medical disclaimer slide is above. Please take a moment to review the health-related information on the slide. The medical information we share in this program is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment purposes. Please consult your healthcare provider before making any healthcare decisions for your guidance or for guidance about a specific medical condition. We are unable to answer any personal health-related questions. Please consult with your healthcare provider for that. Later in the program, you'll have an opportunity to practice some exercises with us. If you choose to practice, please do so safely, staying within your own comfort zone. Bone Health and Osteoporosis believes everyone should have a personalized bone health plan, including the following: understanding your personal fracture risk factors, which is knowing your 10-year fracture risk by using the Bone Health and Osteoporosis Foundation Fracture Risk Calculator, developed by the American Bone Health. Talk to your healthcare provider about your osteoporosis risk factors and getting a bone density test if necessary, and then determining which, if any, risk factors need to be addressed. The talking with your healthcare provider provided in the related content will help you prepare for this discussion. Being active, getting appropriate physical activity by practicing bone safe exercises and proper body mechanics. You want to eat well by including a variety of bone healthy nutrition. Prevent falls by taking steps to improve your balance, strength, and adjusting your living environment. And taking medicine. If your healthcare provider determines it's needed, then take the medicine prescribed. Make sure to work with your healthcare provider to determine the best course of action. Today's program, Stepping Out Strong, focuses on just one component of the bone health plan, preventing falls through balance and strength. Did you know that 1 in Americans over age 65 fall every year? Falls are the leading cause of fatal and non-fatal injuries for older Americans. Falls are costly in dollars and in quality of life. However, falling is not an inevitable part of getting older. Through practical lifestyle adjustments, we can reduce the chance of falls and injuries from falls. We work in collaboration with the National Council on Aging to raise awareness and prevent falls. We want to be sure that you walk away with some key messages and next steps, including understanding the link between falls and fractures, discover the benefits of exercise for fall prevention, assess your static balance, learn some simple exercises that can help, leave with a roadmap for better bone health. So before we go any further, let's practice good, healthy posture. Everyone sit back in your chairs with your buttocks to the back of the chair. So scoot as far back as you can in your chair. Place your feet flat on the floor. Roll your shoulders up and back. And your chest. Take a deep breath. And now try to keep that sitting here. You're trying to stack your body up with your ears over your shoulders and your shoulders over your hips. If we can prevent falls, we can prevent many fractures. We'll look at the stats in a moment. As we age, the bones lose their mineral density and the structure becomes thin and unable to take normal weight, leaving bones that break more easily. As you can see in those pictures above, you see those really thin bones on the right. Bones break when they're unable to accommodate the load that we place on them. In the picture, you can see the healthy bone on the left that is strong. It holds us up, it protects our internal organs, and when muscles contract and relax, it helps the bones around us move. You can see that the bone on the right is thinner and not even connected in some places. This bone may break with even the mildest fall. Osteoporosis or bone loss is significant, silent, and sadly can cause death. There are more than 2 million preventable fractures each year. That number is expected to increase to 3 million by 2025. Compare that to other health problems like breast cancer, heart attacks, and strokes. You can see that the number of fractures is more than those 3 health problems combined. We must all make bone health and fracture prevention a priority. Osteoporosis affects men and women from all racial groups and can rob people of their independence and quality of life. But the good news is that osteoporosis is very preventable and treatable. Today is a great day to take action that will improve your bone health for your lifetime. Hip fracture is a potentially life-threatening injury, especially for older adults. The first year after a hip fracture appears to be the most critical time for potential survival. When people survive a hip fracture, these are the possible consequences: permanent disability, inability to walk independently, inability to live independently, and financial burden. All these consequences can impact someone's daily activities such as bathing, dressing, and cooking. So this is a picture of the progression of height loss that results from spinal compression fractures. As the bones in the spine become more compressed or broken, the lungs and the digestive organs become compressed too, and people start to have problems breathing and eating. Vertebral fractures are the most common type of osteoporotic fracture, with more than 750,000 vertebral fractures each year in the United States. Only about 1/3 of vertebral fractures are recognized by the patient or the healthcare provider. Your spine is a column of vertebrae with discs in between them like stacks of blocks. Ideally, they stay strong and even sized. But if the bone in the vertebra becomes weak, a slight movement can cause it to compress, crush, or break. Most of the vertebral fractures that occur happen in the upper back between the shoulder blades. The bones that were once block-shaped become wedge-shaped or triangular. When a number of triangular bones are stacked, the spine, what was once straight, starts to bend forward, causing a stoop posture, or otherwise known as a kyphosis. Vertebral fractures may cause pain or they may be silent. In a person with very low bone density, doing even routine things like putting something up on a shelf or bending to pick up a bag of groceries, this can cause a vertebra to break. Once you have one fracture, your spine is more inclined to move forward, and the risk of a second fracture is even higher. Most falls are caused by the interaction of multiple risk factors. Your chance of falling increases with the number of risk factors that you have. The risk factors on this slide are age, chronic medical conditions that affect walking, low blood pressure, previous falls, fear of falling, multiple medicines, poor vision, muscle weakness, and poor balance. If you're taking 4 or more medications, you're at a high risk for falls. This actually has a name. It's called polypharmacy. Make sure you talk to your healthcare provider if all the medications you're taking are necessary, and make sure that they are not interacting with each other in a negative way. Get your eyes checked. Vision plays an important role in preventing falls. Have you had your eyes checked lately? We're going to focus on muscle strength and balance in our presentation today. By working on 2 of these risk factors, you may already decrease your fear of falling. There are many things that you can do to prevent falls at home just today. Let's focus on a few of them. Check your stair carpet. Is it loose or torn? Does it have so much padding that it's difficult to feel the front edge of the stair? Make sure the carpet is firmly attached to every step, or remove the carpet and attach a non-stick rubber tread to the stairs. Throw rugs are one of the most common causes of falls in the home. Notice that the bedroom is not listed on the slide, but it's also important. After this event, look around your bedroom and consider ways that you can improve your trip hazards. Here are some ideas. Put night lights and light switches close to your bed. Keep a flashlight by your bed in case the power is out and you need to get up. Keep your phones near your bed. You can download this handout, as you see in the slide above, ways to prevent falls at home, for your future reference. Is everybody still sitting up tall? Notice if your posture slumped. Let's explain the benefits of exercise for bone health. Weight-bearing exercise strengthens the muscles and the bones. Flexibility improves mobility. Balance and agility exercise help prevent falls and fractures. Building your core and doing extension exercises help build the muscles that support the spine. When you put all those things together, exercise can prevent falls that lead to injuries or fractures. The adage is true. If you don't move it, you will lose it. As we age, we begin to lose muscle strength, sometimes referred to as muscle mass. A loss of muscle mass can lead to varying degrees of inability to perform daily activities. After age 30, we begin to lose leg strength, and we can lose 3 to 5 pounds of muscle mass every decade. We need to do everything we can to prevent that. You can reduce your risk of falling if you have good leg strength and balance. So, what kind of exercises should we do? In just a few minutes, we will help you get started with proven, simple balance training and some simple postural strengthening exercises. Some good suggestions for exercise are to find a group class or activity that you enjoy. Find a friend to exercise with and make it a regular event. If you have an appointment to exercise, you're more likely to do it. Add it to your calendar. Even if you can't get out, there's many walking DVDs or other exercise home programs to help you stay active. It may be difficult to begin with a visit. It may be helpful to begin with a visit to your healthcare provider to discuss starting an exercise program, or ask for a referral to a physical therapist to assess your exercise needs. We all need to start somewhere. The good news is that we can improve no matter where we are, so don't be discouraged. Even as simple as parking your car further away or walking around a store for another 5 minutes adds to your walking. When we start doing the activities, I want you to think about when and where you might be able to incorporate them into your daily routine. We'll share those with each other at the end. So available to download is the Roadmap to Fall Prevention that includes some movements to help prevent falls. So falls can lead to both fractures and other injuries. Therefore, balance plays a key role in preventing falls. Falls are more common after the age of 65. Falls are the leading cause of fatal and non-fatal injuries for older Americans. 25% of seniors fall each year. Every 11 seconds, a senior is seen in the emergency room for an injury related to a fall. Falls cause over 2.8 million injuries a year. Although this slide focuses on older adults, falls can be life-altering for younger people as well. The remainder of the program, we will focus on one of the main fall risk factors, otherwise known as balance. We will be watching a series of 6 videos covering static balance assessment and the other important exercises that help to decrease fall risk. Before each video, we'll have a slide that explains what you'll be doing. These are simple exercises that you can do on your own based on your comfort level. You can just watch the video of the exercises. If you choose to follow along with the exercises, please do so safely. Have a sturdy chair set up against a wall. Have an open area free of obstacles or clutter. Have the cat or dog leave the room. Have your cell phone nearby if you need to call for help, and preferably have someone there who is able to help in an emergency. Please stay within your comfort zone. If you don't feel safe, please don't do the exercise. And always consult with your healthcare provider about what exercises are safe for you. Please download a handout that comes with the exercise information. It's important to start by assessing your balance because balance is something that can be improved. Everyone should know where they are starting. There are multiple kinds of balance that you can be tested for, but in our program today, we're focusing on static balance, which is the ability of an individual to remain standing on one foot in an upright position without large movements or needing to put your other foot down. We will count to 30 seconds for each leg so that you can get your personal baseline. Whenever you get to the point where your personal baseline becomes easy, that is when we suggest that you make it more challenging. A goal of 30 seconds on each leg is a reasonable target for when to progress the challenge. But if you can't get to 30 seconds, just take whatever the best number is, and that's where you begin to try and push the challenge. We will start by getting a baseline of where your static balance is today. We have provided a handout in today's program that you can download at the end of the event to record your time and set a goal for yourself. Let's watch this short video with peer educator Beth Kaplanek, who will give the instructions, and you can follow along as she counts. There she is.
Hello, everyone. This is Beth Kaplanek, and today with American Bone Health, we're going to be doing a balance assessment test. We are going to assess your static balance. It's a very simple procedure. You need a chair, which you're going to be standing behind, and I'm going to be asking you to pick up one leg and hold it. We are going to count to 30 seconds. I'm going to count out from 1 to 30, representing 30 seconds. You're going to determine, with no hands, how long you can hold your leg up. 30 is a great marker to work towards, and it's a very good standard, okay? We want to work up to getting there. Balance is something that is important to do on a regular basis. It's an exercise like any other, to know where your body is in space. The goal being is to prevent falls. So this is what we're going to do. You're going to stand behind a chair with both hands on the chair. I'm going to be asking you, after I give you a little more information, to pick one leg up, and then when you're ready, you take your hands off, and I'll start counting. Now, I'm going to do the test with you today, and I'm going to stand at the side of the chair, and we're going to get started now. I'm going to give you a couple little hints as we get started. Stand firmly with your feet hip distance apart. Stay firmly in your feet. Now I'm going to pick up my left leg first. So I'm going to put a little more weight onto my right and pick up my left heel, and your hands should be on the chair now. Stand tall. Take a big breath in. And when you breathe out, I want you to pick up the left leg. And when you're ready, we're going to take our hand off the chair and I start counting. So let's get started. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, that's the first leg. That was my left. You'll notice I put it down at 21 because I started to waver too much. So that's where my marker is today, 21. Now, where did you get to? 10, 15, 20, maybe all the way to 30. Now, over time, if you can get to 30, you might want to think about working on an uneven surface with a person that can work with you, a qualified instructor, to help you go to that next level of balance. But in the meantime, balance is a very important thing to practice. As I said, we want to prevent those falls. Let's do the other leg, shall we? All right, I'm going to put my hands back on the chair. You're behind the chair. Now, I'm going to be picking up my right leg. Stand tall. Now, this time, I want you to find a focal point to look at, something across the room. Keep your eyes on that. Stand really tall. Now, putting more weight on my left foot. My right heel is up. I'm picking up my right leg. And I'm going to start the counting. You ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I just made it to 30, but I got there. So I'm a little bit better on my right than my left. So I need to practice, and so maybe all of you. So again, balance is a very important concept for preventing falls. Make sure you're practicing it. It helps you learn where your body is in space. And I thank you for being here.
As we all do. Make sure when you take notes as to where you're standing, write down if you're barefoot, write down if you're in shoes, write down what the floor is like so you can repeat it the exact way that you did it. And then when that gets easy, change those surfaces or your shoes. So once you know your baseline, be sure to start practicing every day, because remember, if you don't use it, you lose it. Begin where you are and work to improve. Some examples that can include closing one eye, adding dynamic movement with your arms, legs, or both, or practicing on an unstable surface. Balance is the foundation of all safe movements, including traveling, playing with grandchildren, or dancing at a wedding. Whether you're moving your balance skills to another level, make sure you stand near a chair or another sturdy object so that you can reach or catch yourself if necessary. To get additional assistance and evaluation of other types of balance assessments, we strongly suggest working with an osteoporosis trained exercise professional to help create an individualized safe balance plan. So what is proper alignment? Beth will be using a wood yardstick to illustrate proper postural alignment. You can take a dowel, broomstick, or yardstick and place it on your back. It should touch 3 points: the back of your head, between the shoulder blades, and between the hips or the sacrum. Feet are hip width apart, which is standing with the second toe, kneecap, and middle of the hip crease in one line. You should try to maintain this form whenever you do any activity, especially exercise. So when you hinge forward, you maintain all points on the stick. Avoid rounding forward. Strive to maintain a good, tall postural alignment always. Please watch the next video.
Hi, we're back. Now we're going to look at what is proper alignment in order to sit to stand or hinge over to do an activity of daily living, like picking up a package, brushing your teeth, making the bed, and so on and so forth. In order to do that, we're going to use the assistance of a dowel. This is from a mop, which I unscrewed, and this is a wooden roller. You could just as easily use a wooden dowel to do this. This is going to be used as a tool to help you to find proper alignment when hinging over to pick something up. Let's go through a couple of basics and then put it all together. First, I want to start by getting you into a hip distance standing position. So let's start by looking at the feet and thinking of the feet as being tripods, the back of the big toe, the little toe, and the heel as tripods. And then we want to find hip distance apart by looking at the second toe, ankle, knee, and hip alignment. We want to follow that line up as best you can. We're looking at trying to find the hinge right at the hip, which I had mentioned earlier. That is the place where the thigh bone meets the pelvis. And when I pick this leg up, this crease is called your hip hinge. And we want to use the hip hinge in the area of learning to bend over, to sit, to stand, or pick up a package. The stick is going to be used on three prominent parts of my back, the three parts that go out on the spine more than the neck or the lower back. And those are the back of the head, the thoracic spine, right around where my rib cage is, right between the shoulder blades, above and below that, and my sacrum, which is at the top of my rear end. I'm going to take the stick and place it on those three spots and try to keep it on those three spots as I hinge at the hip, keeping proper alignment. You want to stand really tall in this, and I'm going to turn to my side now, stand tall, feet hip distance apart, thinking about my tripods. I'm going to take the stick and place it on my bum, on my ribs, and then bring my head back to meet that. Now I'm going to start by hinging at the hip to hinge straight back, trying to keep those parts on the stick, and then come back up. I'm going to inhale, grow tall, then exhale, send my booty back, hinge, and now try to leave the stick from my body as I hinge. So I want to keep those parts on the stick as I hinge, and then come back up. The purpose of this is to help you re-educate your body and the ability to hinge properly to pick something up. We don't want to use a rounded posture to round over to pick something up. Number one, it's not good for your lower back and could create pain. But number two, too much forward flexion, especially in the thoracic spine, can lead to a fracture. So learning how to hinge at your hip using proper alignment to sit, to stand, or pick up a package is extremely key. Thank you.
Now let's talk about incorporating a leg strengthening exercise. First, watch this next video that demonstrates proper body mechanics for the sit to stand motion.
Hi, now we're going to put it all together. We're going to work on learning to sit to stand properly using that hip hinge and proper alignment that we were just discussing. We're going to be using the assistance of a chair. And before we get started, I just want to keep in mind that many of you may not be able to do it exactly as I'm demonstrating right now. And if you need the assistance of placing your hands on armrest or the edges of the chair to do this at this time, please do. Then over time, as you gain strength, I want you to start taking your hands off and do the sit and stand without your hands. So let's get started. We're going to do about 8 to 10 of these. I want you to sit on the front of your chair. Your feet are flat on the floor, hip distance apart, as they were discussed before. And maybe your heels are just in line with your knees, or just a little bit further back, if that feels more comfortable. Plant your feet, sit up nice and tall. Press your hands on your thighs, hinge at the hip, keep that proper alignment. Stand at your feet by pushing your feet down and stand up. And maybe a little more weight into the heels. Now hinge at the hips, come back down. Now carefully hinge at the hips and come back up. And we're going to count this out. We're going to do 8 of these. Inhale, exhale, stand. And that's 7 and 6. And now I'm going to take my hands even further forward, make it a little more difficult. 5, 4, 3, 2, and 1. Good. So practice your sits to stand every day using the proper alignment that we worked on before. Hip distance apart, set to the front edge of your chair, and work those muscles in those legs to stand. Thank you.
As you improve your strength, you can make this even more challenging by hovering over the seat of the chair and holding the modified squat for as long as you can. And don't be discouraged if you can only do one initially, that's fine. So next, Beth will demonstrate the proper form for exercises that can strengthen your calves and increase your ankle flexibility.
Hi, we're back. We're going to be working on ankle and calf mobility, which are very important for balance and stability in standing. So we're going to think about the feet. We'll start by thinking about the feet. You're going to be standing behind your chair. I'm going to be standing to the side of the chair for demonstration purposes. So earlier I mentioned the feet is like a tripod, the back, the big toe, little toe, and heel. So find that nice planted foot. Stand really tall in your spine. Think about having a string on top of your head reaching you to the ceiling. Good. Now we're going to rock forward onto the balls of the feet, lifting the heels, and then we're going to lower the heels and lift the balls of the feet. And that's the work that we're going to be doing. You have both your hands behind the chair. I'm facing you so you can see what we're doing. I'll have one hand on the chair. And if you don't need your hands at all, of course, that's fine. So start by taking a big breath in, put most of the weight on the balls of the feet, which is the area right behind the toes. Lift your heels and come up tall and think of rolling through the big toe and second toe. Don't let the foot go open. Then lower the heels and then lift the toes. Good. Lower the toes, lift the heels, lower down, lift the toes, you're on your heels, and do that continual action for 4 more. Now I'm on the balls of the feet, making sure that I'm lifting up evenly on all balls of those feet, all 5 of them. So put a little more work through the back of the big toe, second toe, so you come up evenly and down. And notice when you lean back, the front of your leg really has to engage in order to keep that balance. Then when I go down and I lift my heels, you feel the backside engaging a little more. So let's do that a few more times. 2 more. Good. Last one. Good. Now stay up on your heels. And now we're going to lower and lift for 8. 8, 7, 6, 5, 4, with hands or none, 3, 2, and 1, and come down. So try to incorporate this exercise for ankle and calf mobility into your movements every day. Thank you.
How are we all doing? Finding things that you can do and can't do? As you progress, you can make this even more challenging by standing on one foot and lifting up. When might you be able to do this during your day? If you have an idea to share, please write it in the Q&A window, in the ask a question window, I'm sorry. Everybody writing down their ideas?
One person, Jamie, has said while brushing your teeth.
That's a good idea. Some other suggestions are standing in the line at the grocery store. Brushing your teeth is what somebody said. Talking on your phone. And don't forget, if it's hard to do in standing, you can always practice in sitting first. Just keep your feet flat on the floor, lift your toes up or lift your heels up. As you get better at that mobility, then you could do more in standing for better strengthening. Okay, so always think throughout your day of how you can incorporate all these ideas into your daily activities. Even while you're standing, well, as long as you're safe, but while you're standing at the counter cooking, you can go up and down on your toes. It's pretty easy whenever you're on your feet. All right, we'll move on to our third exercise is to strengthen the legs and hips. There's more to the exercise than meets the eye. The work is primarily on the standing leg and torso rather than the lifting leg. Let's watch this video to show you what I mean. Show you what I mean. By the way, you will notice Beth says abduction, abduction, which is how we sometimes pronounce abduction, which is the movement of the limb or other body part away from the middle of the body or away from another part. We do this to differentiate the word adduction or adduction, which is the movement of a limb or other part toward the midline of the body or towards another part. So it's abduction or adduction.
Hello, everyone. Now we're going to work into some movements that are going to work on hip and leg strength. The first movement we're going to do is doing abduction, taking the leg out to the side. And these exercises are a lot harder than they look. So you're going to be standing behind your chair to do this work. I'm going to stand to the side so you can see the full movement and keep one hand on the chair. So you're going to stand hip distance apart, stand really tall in your spine. If you want, you can take one hand on your hip. That's up to you, but otherwise both hands should be on the chair. I'm going to shift my weight over to my left leg and start to stand a little more onto my left leg and start to lighten up the right. I'm going to pick up the right just an inch, and I'm putting my hand on my hip just to keep my pelvis stable because I don't want to drop or lift my hip. I want to keep as stable as possible. And I'm going to take this leg out to the side and hold for 1, 2, and then bring it back in. I'm keeping the foot flexed. I'm grazing it over the top of the floor, trying not to drop it, but if I needed to drop it, I could do that. So you can come back and just bring it back down and then pick it up and hold 1, 2, and down. So let's get started, and we're going to do 8 of these. So everybody join me now. So I'm going to put all my weight on my left, pick the right foot up. I'm going to take that leg out of the hold for 1, 2, and bring it in. And that's 1, 2, 7, 1, 2, 6, 1, 2, 5, 1, 2, 4, 3 more. Hold, out, hold, bring it in. Last 2, 1, 2, 2, and 1, 2, and 1. Good. Now, a couple of things, if that was difficult for you to do or it didn't quite feel right, you can just take and stand in the left leg and take that right leg out and just hold it out there. Just holding it out there is putting all the weight in the stance leg and really working on these abductors just to hold that leg out. And when then you're ready, you pick it up and then follow the movement fully. Okay, good. Let's go to the other side. I'm going to move my chair over. Again, you're standing behind it. I'm going to keep my right hand on the chair, stand hip distance apart with my feet and legs, put all the weight more into my right leg, pick up the left foot. I'm holding my hand on the hip just to keep pelvis stable. I'm going to bring that leg out and hold it for 1, 2, and bring it in. 1, 2, 7, 1, 2, 6, 1, 2, 5, 1, 2, 4, almost there. 1, 2, 3, 1, 2, 2, last one. 1, 2, and come in. Great. So this is very good standing leg work, and it's a lot more than meets the eye. So work on it in the level that you can do with hands, without hands, with whatever you need, or just holding the leg out there until you're ready to pick it up. Whatever it is, start. and do this daily. Thank you.
All right, moving along here. It's valuable to move slowly through these repetitions to train the standing leg and torso to become strong throughout the entire range of motion of this exercise. So don't forget you're working the leg that you're standing on as well as the leg that's moving. As Beth mentioned in the video, as you progress with this exercise, you can lift your hands off the chair and challenge your balance. You can also lift and hold a little bit longer. The last exercise, we will work the big muscles in your legs to help with the hip strength and balance. 60% of the normal gait cycle is spent on one leg. If you are not able to briefly stand on one leg independently, there is a dysfunction in your walking ability, which puts you at greater risk for falls. Please watch this video.
Hi. Now we're going to continue the leg strength work, and we're going to be working on the big muscles and the front of the leg. The front is the quadriceps, the back is the hamstrings. You're working both, but it'll be a little more predominant from the front. So we're going to be doing a situation where you have your chair turned like this, and you're no longer standing behind it. Is you're going to put the chair to the side. I have my left hand on the chair. I'm going to stand hip distance apart, and let me demonstrate, and then we'll do the movement. So I'm going to shift my weight over to the left leg and start to pick up my right heel. Find that nice crease in the hip that we've been talking about. Put my hand on the hip to find that crease and assist it, and bring that leg up to 90 degrees. Good. Now with this, when I pick that leg up, I don't want to curl the spine. I want to stay very tall in my spine, and we're going to hold for 2 counts and then place it back down. So let's all get started. Stand hip distance apart. Stay very vertical in your spine. Grow really tall. Breathe in, shift your weight over to the left, pick up your right heel. Exhale, pick that leg up. You're going to hold for 1, 2, and lower, barely touching, and pick it back up for 1, 2, lower. Good. 1, 2, 6, 1, 2, 5, 1, 2, 4, 1, 2, 3, 1, 2, 2. Last one. 1, 2. Now we're going to hold it here, and we can add that balance. We're not going to do the whole balance move, but at this point, you can add the balance into this and try to stay up as long as you can, ideally working up to 38 seconds, right? So we can add that to the end of this movement. Let's go to the other side. So let's take the chair over to the other side. I'm going to stand hip distance apart on this side, shift my weight over to the right, hinge at the hip, and pick this leg up. Good, and I'm all ready to go. I'm going to hold for 1, 2, and lower, up, up, lower, up, up, lower, stay tall. 1, 2, 5, 1, 2, 4, almost there. 1, 2, 3, stay tall. 1, 2, 2, good. 1, 2, let's add one more. 1, 2, and let's hold it there. Stay as tall as you can and go back to maybe taking your hands off and try to find this nice ideal position. Try to end with a little balance and then let it go. Good. So that was a little bit more about leg strength, working the big muscles in the thighs. And I hope you've enjoyed this. Thank you.
Good. Hopefully you guys are doing well, challenging some muscles. As you progress, you can make this more challenging by holding the leg that's lifted longer, working up to 30 seconds, and you can balance without holding onto something. So let's review the main points that we've covered. Exercise can prevent falls and fractures. Practice good posture and alignment all the time and in everything that you do. Stand tall and hinge at the hips when you bend, keeping your back straight and protecting those spine bones. Balance on one leg every day and work on leg strengthening exercises. There are many times a day when you can incorporate these simple movements. Make your home safe, prevent falls, be mindful, pay attention to what you're doing. Many falls are a result of inattention, getting distracted, letting your mind wander, multitasking. P.S. Don't text while walking. How many people do you see walking through a parking lot texting on their phones? Consider a community exercise program. If you need more support, there are community programs that can help. Check with your local senior center or call Bone Health and Osteoporosis Foundation for assistance. I also have another announcement here that there's a webinar from one of our partner organizations, the Arthritis Foundation. If you or someone you know would benefit from exercise for people living with arthritis, please register and attend the webinar Movement with Arthritis, on July 24th. The link is in the chat and will be also included in the follow-up email. It's from 7 o'clock to 8:15 on Thursday, July 24th. It will go over discovering how exercise can improve joint function, reduce pain, and enhance overall quality of life for individuals with arthritis. Learn about community programs and personalizing a fitness plan that's right for you. So stay in touch with the most up-to-date information by signing up for the newsletter, connecting with us on Facebook or Instagram, or emailing info@bonehealthandosteoporosis.org. As part of a bone health plan, we recommend everyone know their fracture risk by using the Bone Health and Osteoporosis Foundation Fracture Risk Calculator. To determine your personal fracture risk, go to the link provided. All right, so stay in touch. Thank you for watching this program. Please help end fractures and osteoporosis is a major public health problem. Thank you.
Thank you, Jamie. Great presentation. I hope everyone was able to do a little bit of practicing along with the videos. We have quite a few questions that came in, so we'll try and work through those and get as many as we can answer to stay within the hour. So the first one we have here is, when I stand on one leg for balance, should the leg on the ground have a straight or bent knee? And what shoes should we wear, or is it better to have bare feet?
So the leg that you're lifting, the higher you lift it, the more challenging the exercise will be. So if you're a beginner and the leg is just hovering over the floor and your knee is straight, then that's great. If you want to make the challenge harder, then you lift your knee to hip height. Regarding shoes, I mean, like I said before, practice in a variety of shoes. Practice barefoot, because think about your day. Who knows where you're going to be and when? And if walking is, you're on one leg 60% of the time, you're always in a variety of shoes. Typically, I would say barefoot is the most difficult because your foot has to really find the ground. However, with all these shoes that we wear now, because there's so much cushion, sometimes it's hard to feel the ground in some of them. So practice at everything.
Great tips. So someone's asking, they have a hard time aligning their second toe, knee, and hip. And so it sounds like they have knock knee. Is there any suggestions?
So the suggestion is do the best you can. I mean, your anatomy is your anatomy. You can't correct it, but maybe you need to see a professional and have them explain to you better ways. Like if you're knock knee, to engage your hips to help with your alignment. Sometimes you have to work on some muscles on one side of the leg compared to the other to help you be more upright. So if you feel like it's a challenge, then get someone else to help you, to give you some ideas, but stand with how you are, because that's what you have to practice.
So someone wants to review one of the exercises. Should we have a straight or bent knee for the standing on one leg exercises?
So I'm assuming this is talking about the stance leg, the one that you're actually standing on. Your leg is pretty straight, although you don't want to fully lock it out and hyperextend it. You want it to be straight, but a little bit relaxed at the knee. You don't want to be on a very flexed knee. You want it to be a comfortable straight knee, but not hyperextended, which means locked out.
Is it common for balance to be more dominant on one side of the body?
Yes, it's very common for one side of your body to be different than the other side. Typically, you're a little bit stronger on your dominant side for balance, but you never know because some people are stronger on the other side.
Does that seem to follow if you're right-handed or left-handed?
Yeah, so typically you're probably a little bit stronger on your dominant side, like if you're right-handed on your right leg, because it's usually your stronger leg. But of course, there's always someone that stands out that's different.
Um, Here's a question about yoga. I'm not sure if you know too much about that, but is beginner yoga good for strength and building balance?
Yes, anything that's going to challenge your body and move your body into different positions and move you against gravity and with gravity and up and down from the ground, which are great things to practice and working on your balance. It's all great. And if you're a beginner, beginner's the way to go.
And I just want to further that we do have some peer educators that are trained in yoga for osteoporosis as well. So that there is something out there like that. Um, the webinar for the arthritis that we mentioned, that will be in the follow-up email, and I believe it will be in the chat as well. But no worries, it'll be in the follow-up email for you to register. That's a little bit later in July. So I do want to mention, I did see quite a few questions about um, osteoarthritis. So that would be a great presentation to attend and listen to for those people that had those questions. Let me check the chat here. I think there was a couple questions that I saw in there. Oh, somebody asked about weighted vests, if you could comment about those.
Weighted vest is obviously a very popular thing these days. What I would probably say is that if you have osteoporosis, I would just be careful with the weighted vest because it is a load on your body. Um, so if you're just looking at, if you don't have osteoporosis and you're looking to help strengthen your body a little bit more, the weight of a vest is helpful. There's different recommendations as to the percentage of weight that you should add. So I'm not exactly sure on those details.
I do want to point out too, we have BoneFit trained exercise professionals and physical therapists. You can find those. The link is in the chat for people throughout the US who are trained in bone safe movement. And so you can check on there. And if someone's not in your area or surrounding area, please do check back because we're adding new people throughout the year.
And one more point regarding the weighted vest. Just be careful if you have a really kyphotic posture. Just you have to take note of how that vest is going to load your body. It might be encouraging into not the most dominant posture. So just be careful with those.
Someone has a good question, maybe comment here about balance. When discussing causes of falls, don't underestimate the role of bifocals, especially on stairs, as well as shoes. This person says they've fallen with slippery shoe soles on wet surface and conversely with textured soles sticking on the carpet.
Yeah, that's a great point. And don't run down your stairs, your wood stairs in socks.
Right. Is it okay to wear a backpack for carrying items if you have uh, osteoporosis?
Again, I would just be careful of your posture while you're wearing it and the amount of weight in it. it probably ideally will help hold you upright a little bit, but you want to make sure you're not overloading your body in areas that are stressed.
Yeah, and I just want to further mention too, if you're carrying a backpack and you have osteoporosis in your spine, that can increase your risk for vertebral fractures depending on the weight. So that's probably something you want to check with your healthcare provider, or if you work with somebody trained in osteoporosis exercise, that would be a great question for them as well. I have scanned through the chat, so I'm not sure. It looks like all of the questions have been answered, but if for some reason um, we didn't get to your question, please feel free to email us at info@bonehealthandosteoporosis.org, O-R-G, and we have put that up on the slide. It'll also be in your follow-up email. So we have time for just one or two questions here that just came in. Are there any tips to consider when someone goes on vacation?
I'm not sure about that question, but if you could, any of these exercises that we did today, you can do on vacation in your hotel room. There's always a chair. You can hold onto that chair, make sure it's safe and sturdy. When you're brushing, you're always brushing your teeth, so you can still do your exercises there. Is that what you would go towards, Anne?
Yeah, and I think also too, planning is probably really key in vacation. Looking at where you're going, what the terrain is going to be, uh, seeing where you're walking, is it on concrete or gravel? So I think a little bit of planning could go a long way in checking out what your vacation, arranging a vacation and keeping yourself safe. And we'll go ahead and ask one more question about sleeping positions for kyphosis. Is there any better suggestion for that?
Sleeping is always tricky to answer because obviously the most important thing about sleeping is sleeping. You want to make sure that you're in a comfortable position so you can sleep. If you have a significant kyphosis, obviously I would imagine sleeping on your stomach is not comfortable, although spending a little bit of time on your stomach here and there throughout your day is not a bad idea. And you can learn how to prop yourself probably with pillows. I'd probably say sleeping on your side with pillows between your legs and under your arms and in the proper position would be most beneficial. But it's, yeah, and on your back would probably not. It depends on how much of a kyphosis you have as to whether or not your head will reach the pillow. You can build the bed up and the pillows up to reach your head, but you don't want to push your head into a further kyphotic position. So you have to play around
True.
with pillows.
So just to finish up here, to find more information, you can check with your local senior centers to see if they have any classes good for a person with osteoporosis. We have provided a handout in this program. It follows the National Council on Aging and their evidence-based programs. So I would encourage you to take that and see if review that handout and see if there's any programs at senior centers or YMCA's local in your area. And then also check out the Bone Health and Osteoporosis Foundation website for bone fit trainers in your area as well. I'd like to thank everybody. We're at the end of our time today. And again, please feel free to reach out if you have any other questions, and be sure to check out our events page for any future programs.
Thank you for being here.